Okay, hi everyone. I am Ivonne Yamal. I am Director of Division Sexual Reproductive Health FIGO. For me, it's a pleasure to be here for this lecture about reproductive rights as human rights beyond borders. Our Division of Sexual Reproductive Health and Wellbeing in FIGO, the goal is a woman is free to decide to access her reproductive rights as human rights. You know, in December 1948 in Paris, the United Nations General Assembly published the Universal Declaration of Human Rights and included the right to medical care. And 1994, the International Conference on Population and Development in Cairo began to consider reproductive rights as grounded in the existing human rights. FIGO, in the Cartagena Declaration in November 2022, declared that access to sexual and reproductive health and rights is a basic and non-negotiable human right of every woman and girl in the world. A woman have access to the modern methods of contraception, safe abortion, and fertility care. Last year, we made a publication in August 2024, Beyond Borders, the global impact of violating reproductive human rights. In this publication, we talk about the right no discrimination and equality, uniform access to all aspects of sexual reproductive rights, including abortion, contraception, and fertility service, as well as comprehensive sexual education for all individuals without discrimination based on age, gender, ability, sexual orientation, race, marital status, or socioeconomic status is vital. The right to participation. Communities and civil societies should engage in healthcare provision across the reproductive life cycle and empower the health service user by including explicit strategies to address power imbalance. Accountability. Accessible and effective accountability mechanisms, including administrative and judicial remedies to happy sexual and reproductive rights, are necessary. What about the reproductive rights around the world? Abortion rights. You can see here the legal status of abortion in 2022. So many countries are restricted and access to safe abortion. In USA, in the past, USA was permission to access abortion. Now, that's changed completely. Very restrict, more restrict is very, very many states. So many, so low, few for access to abortion. That is very, very worse. But no, it's only in USA. Sierra Leone, Poland, and Morocco risk criminal prosecution for obtaining or seeking abortion. Japan and Indonesia require waiting periods of spousal consent for abortion care, therefore violating the right to timely healthcare access. In Salvador, Paraguay, Honduras, no access to safe abortion. What about contraception rights? We know, of course, the possibility to access the contraception is not easy around the world. And funding concerns that oral contraceptives are likely to major health problems or IUDs carry a high risk of infection. Types of contraception are considered abortifacients. In USA, the contraceptive coverage from workers' insurance benefit based on the company owner's religious belief. And that is very impossible to access to contraception. What about fertility rights? WHO recommended undertakes research equitable access to assisted reproductive technology by single person and person with diverse gender identities and sexual orientation. The possibility to measure of disparities, equities, and mental health or well-being for access to fertility care promotes a communicated right-based equitable access to fertility care and contraception in the context of diverse regional and global fertility rates. We have so many barriers for access to fertility care. The majority of patients who undergo IVF in the United States pay out of pocket for their medical treatment because either they lack health insurance or their insurance policies exclude fertility care, covering fertility diagnosis only of exclude IVF. The U.S. Center of Disease Control and Prevention has recognized that infertility treatment can also be expensive, and economic and regional racial disparities in access to and use of infertility services are clearly present. Studies confirm that compare the presence in USA population, persons of middle or lower socioeconomic status, and persons of African American or Hispanic ethnicity are underrepresented in the population of treated fertility patients. Building a family is a basic human right. Infertility is recognized as a disease by the WHO and American Medical Association. Economic factors are the chief contributor to disparities in access to effective treatment. However, social and cultural factors play a role as well, including individual or systemic discrimination that disadvantage certain people because of their race, ethnicity, sexual orientation, or gender identity. In Germany, legal rulings apply different criteria to single individuals, same-sex couple, or impose age limit that violate the right to no discrimination and equality or ban service such as egg donation or surrogacy. In USA state of Alabama, IVF was ruled illegal through the Supreme Court, which equated the status of embryos to extrauterine children, causing fertility center closed out of concern for legal liability. Access to fertility may not be a health priority in low-income countries. But the human rights and their violation are also extended to healthcare professionals, advocates, and activists working in sexual reproductive health. In USA, at least 11 sexual reproductive health providers have been murdered since 1990, with bombings and 173 attacks against clinics since 1977. In Portugal, Chile, and Mozambique, allow healthcare professionals and even entire facility to refuse to perform abortion-related care despite the detrimental impact this has on women and the subsequent burden they place on their fellow providers. FIGO proposal. Availability. FIGO encourages member societies to deliver a comprehensive service that addresses the complex spectrum of sexual reproductive health needs. These include preconception care, pre- and postnatal service, contraception, abortion, and fertility care. Facilities should be equipped with the necessary supplies, including contraceptive and medical abortion communities, and staffed by trained healthcare personnel who are available to consult and provide the full spectrum of service. Accessibility. FIGO support member societies in advocating for sexual and reproductive health care to be included within universal health coverage, particularly for individuals in crisis setting. Assessing accessibility. FIGO encouraged member societies to be involved in the analysis of physical, geographical, financial, and other barriers to sexual reproductive health within health system and service, with a particular emphasis on how they may affect marginalized communities, including supporting self-care where there is evidence to support its use. Quality. FIGO urges its member societies to provide ethically and culturally appropriate person-centered care. This means providers need to be trained to deliver non-judgmental care, respect confidentiality and privacy, ensure informed consent free from coercion, and recognize the cultural and religious context of the individuals they serve. Around the world, FIGO made a webinar to protect the reproductive rights as human rights. In Latin America, with la FLASOF Federation, Latin American Society of Obstetrics and Gynecology. In Africa, promoting women reproductive rights, human rights in Africa. In Middle East, reproductive rights as human rights in Middle East. We continued. We need to continue this proposal around the world with FIGO and with your Society of OBGYN. Thank you very much.
Thank you so much, Dr. Ivonne, for focusing on a subject which is extremely important and unfortunately often neglected, because reproductive rights are human rights. And in so many parts of the world, particularly in LMICs, women's rights, reproductive rights are really often trampled upon. So it's really important, your work that you're doing in your local area, as well as at FIGO level, to really improve the reproductive rights of women. So we're really grateful to you for that. And thank you so much for this very inspiring lecture. Thank you.